This podcast is recorded and produced on the lands of the Turrbal people. We'd like to acknowledge the traditional custodians of the land and pay respects to their elders, both past and present. Thanks for joining us again on Fertile Ground, a podcast with Dr. Jodie Karuba, where she answers common questions about fertility and the IVF process. Today we're going to be talking about one of the biggest factors in fertility, a woman's age. Dr. Jodie, it's nice to be back with you today. Last episode we talked about the first steps when a woman comes to see you about their fertility, and you mentioned you usually organise some initial investigations. The test I'd like to find out some more about today is the AMH test.
When women are ready to have some investigations performed, probably the easiest investigation is a simple blood test called AMH levels, or anti-Müllerian hormone. And this is a hormone produced from the ovary that gives us an idea of what egg reserve is like dependent on your age. I think the most important thing about eggs is the quality of the eggs, and the biggest predictive factor of the quality is actually a woman's age. So the younger you are, the more likely you are to have good quality eggs.
And what if they do that AMH test and the result comes back low? What then?
Certainly in women who are even younger than the age of 35, if they have a lower egg reserve compared to other women of a similar age, then certainly the first step would probably be to talk to your GP or to come and see someone like me so we can discuss the option of egg freezing and what that might mean for you in terms of the procedure itself, but also, most importantly, what the future might hold for your eggs if you choose to use them.
So if you have a lower egg reserve, does that mean you've got less chance of getting pregnant?
The way I explain it to women who are very anxious about perhaps having a low egg reserve is that if a woman comes to me and she's perhaps the age of 25 and has a lower egg reserve, and she's sitting next to another woman who's also aged 25 but with a moderate or high egg reserve, both of these women still have the same chance of conceiving a baby if they chose to have a baby at the age of 25. So it doesn't impact fertility then. And if the woman has a regular menstrual cycle and is ovulating every month, then her chance is just as good if she has a lower egg reserve compared to the woman with a high egg reserve. But it does mean that in the future, as everyone's egg reserve declines as we age as women, that may become more difficult for her if her egg reserve continues to lower over time.
So what age then is that tipping point?
Around the age of 32 is usually when the egg reserve starts to decline, and the quality of the egg declines as well. So with increasing age, unfortunately, the decline in egg quality means that pregnancy itself becomes more difficult, so it becomes more difficult to conceive. It also, unfortunately, increases the miscarriage rate the older a woman is when she gets pregnant. And then, of course, the older a woman is, it becomes a more complicated pregnancy potentially.
Can you just quickly define what you mean when you talk about egg quality?
That is a very good question and a very scientifically involved question. So the quality of an egg at the moment can really only be determined by its success of fertilization. So we don't have a test for egg quality apart from attempting to fertilize that egg and seeing if the egg is capable of then generating an embryo after fertilization. So it's a difficult question to answer, and there is no test that will tell us about egg quality in a woman. But the biggest correlation is the younger a woman is, the better her egg quality is. So if women are thinking about freezing their eggs, then doing it at a younger age makes a lot more sense.
Yeah, so we're going to talk more about egg freezing in detail in the next episode. But for now, can we go back and talk a little bit about that AMH or egg reserve test? What should our listeners know about that test?
Absolutely. I think that an AMH test is a very simple blood test. It can be done at any point of the menstrual cycle. It is important not to do the test when you're taking the combined oral contraceptive pills or using other high-dose hormones, as that may influence the actual result of the test and falsely lower the result.
How long do you have to be off the pill before you take it?
Ideally, it would be about 3 months.
And can you just ask your GP for that test?
Absolutely. Ordering the blood test through your GP is fine if your GP feels comfortable doing that. If not, then I'm very happy to talk to women about their egg reserve. It is a very simple test, it's a quick result to get back. So I think that's why it's very important before undertaking any test, let alone an egg reserve test, that the person ordering the test knows how to convey that information to the patient in a relevant way and not instilling panic in a patient or unnecessary angst over a blood test that may not have any relevance to that particular patient at that point in time.
And once they have the results of that AMH test, what's next?
I think if they have questions and they're ready to move on with their fertility journey, that it's important to talk to someone who actually has the latest information and that we can distill quite easily for patients into meaningful information and information that hasn't been scientifically proven. I think that patients often just want to discuss the option of something like egg freezing or, where their fertility journey is going. And I think that is a very individual thing, but certainly I've seen plenty of women and couples who just want to perhaps have a fertility health check and discuss what their options are. They're perhaps planning to have a family, but not immediately, maybe in the next 6 months, maybe in the next 12 months. So again, couples can be very proactive with their fertility. If they come and see a fertility specialist, we can do a preliminary workup, work out perhaps the lifestyle changes that they need to perhaps think about making, things like reducing their weight, stopping smoking, stopping alcohol intake or reducing alcohol intake. All of those things can impact fertility in a big way.
And how do you put people's minds at ease about their age when we know that it's so important to fertility, but we can't make ourselves any younger than we are? It feels like something that women really stress about. How do you help with that stress point in your patients, or what would you like people out there to know about age when it comes to fertility?
People are very confronted by their age, and yes, there's nothing you can do about your age. There is something you can do now, and it would always be better to take action now than to do it in 6 months for some women or 12 months for other women. And it's not necessarily age that might be the only factor, but it's also the unknown factor of our egg reserve. And has that been discovered yet? So we need to perhaps work on educating everyone, no matter what their age is, so that they can feel free to have that conversation with their sister or, their daughter, and feel like they have some education around that conversation. And then that enables choice for women, which is so important.
So do you think that every woman, no matter what age, should be getting this AMH test done?
I think that in the right context of doing the test in the first place, women need to be ready to receive the results and understand what that means. So I think jumping in and doing an AMH level for every single woman that comes along without them understanding the implications of doing that test, it may not be suitable for everyone to do. So should everyone be doing it? I think that very much depends on the curiosity of that particular woman, where she is in the journey of her life, and whether or not she feels ready to have children at that point. So I think that is a complex question to answer, and I think that's up to the individual. But yes, the test is there, and we encourage women to know as much about their reproductive health as possible.
Well, I think that's a great place to pause for today before jumping into our next episode with our discussion about egg freezing. I'm really looking forward to that conversation. Thanks so much for taking the time to be with us again, Dr. Jody, to share your expertise.
Oh, my pleasure. There are many more topics that we have to discuss and look forward to next time. Thank you.
Again, thanks so much for chatting with us today, Dr. Jody. In the next episode, we're going to be getting a bit more technical with a dive into egg freezing. If you'd like to talk to someone about your fertility, you're welcome to contact Dr. Jody Karuba's rooms, or for a free conversation, contact Janaea's Fertility Advisor team on 1300 361 795. If you need a referral to see Dr. Jody or one of Janaea's other fertility specialists, our fertility advisors can book and organise a bulk billed telehealth GP appointment.